Hello guys. Today we are going to discuss about a laboratory test called cytomegalovirus. Use of the test. When a young adult, a pregnant female, or an immune compromised patient has typical symptoms that suggest a CMV infection, tiredness, fever, jaundice. When a newborn has multiple congenital anomalies, unexplained jaundice, or anemia, or when an infant has seizures or development problem that may be due to CMV infection. Cytomegalovirus testing is required to determine whether someone is currently or has recently been infected with CMV. It may also sometimes be used to determine whether someone has been exposed to CMV. Testing for CMV involves either a measurement of CMV antibodies or by detection of the virus itself. The virus is detected during an active infection by detecting the genetic material of the virus. In the United Kingdom, as many as 50 to 85% of adults have been infected with CMV. Most people are infected as children or young adults and do not experience any significant symptoms or health problems. But the most common symptoms are fever, tiredness, and jaundice. CMV is found in many body fluid during an active infection, including saliva, urine, blood, breast milk, semen, cervical secretions, and cerebrospinal fluid. It is easily transmitted to other persons through sexual contact and sharing saliva or by contact with infected objects such as nappies or toys. After the initial primary infection has resolved, CMV becomes dominant, dormant, or latent like other member of the herpes family. Cytomegalovirus remains in a patient for the rest of his life without causing any symptoms unless the virus reactivates when a patient's immune system is compromised. CMV can cause problem in three areas. In young adult, the initial primary CMV infection may cause an illness characterized by fever, tiredness, or jaundice. It usually resolves within a few weeks but can cause prolonged illness with fever and sweating. In infants, primary CMV infection may cause serious physical and developmental problems when women are first infected during pregnancy and then pass the infection to the infant across placental barrier. Most fetuses that are infected appear perfectly normal at birth, but may develop hearing or vision problem, pneumonia, seizures, delayed mental development a few months later. A few babies may be stillborn, while others may have symptoms at birth such as jaundice, anemia, enlarged spleen or liver, and a small head. Some of these signs and symptoms will resolve with time, but others may persist. In those with compromised immune system, CMV may cause serious illness and death. This includes those with HIV, those who have had organ or bone marrow transplant, and those undergoing chemotherapy treatment for cancer. Patients with compromised immune system who became infected for the first time may experience more severe symptoms, and the CMV infection may remain active. Those who have been exposed to CMV previously may reactivate their infection. This may affect their eyes, gastrointestinal tract, lungs, and brain. There can also be spleen and liver involvement, and those who have had organ or a bone marrow transplant may experience some degree of rejection. Active CMV also further depresses the immune system, allowing other secondary infections, such as fungal infection, to occur. Sample. The sample required depend on whether testing is being done to determine the presence of antibody or to detect the virus itself, and on the health status of the patient. Antibody testing requires a blood sample obtained by inserting a needle into a vein in the arm. Viral detection may be done on a variety of samples including urine, blood, sputum. Some samples may require a special procedure to collect amniotic fluid, duodenal fluid, cerebrospinal fluid, or body tissue biopsy. results. Normally, it should be negative. That is about CMV.